you did not hear that term burnout other than in the hospital setting 10 years ago, right? I can relate to that. But now more than ever, we're hearing so many nurse educator colleagues, even academic leadership positions are expressing concerns associated with burnout. We're seeing more presidents and more deans as well really get to the tipping point in their career where they have decided to do something different. Well, we are here on a mission to support all nurse educator colleagues, whether you're in a leadership role, or maybe you're thinking about becoming a nurse educator, or maybe you're in a nurse educator role right now and you can relate to having some of these challenges that we're discussing. What we want you to do is take two steps. First of all, we want you to print out that study worksheet. Okay, so the study worksheet is right here in the description. Second of all, we want you to pull out your resource. Okay, now for this snapshot, we're going to follow some resources that are in Dr. Caputi's C&E review book. This is the second edition, and we actually want you to turn to chapter 5. Okay, so let's go ahead and go over content in your textbook that we're going to use to help guide you in our conversation today. We are aligning our content with continuous quality improvement, which is going to help you stay focused on your journey. And it's going to be competency 6 on the blueprint. So if you want to go to nln.org website, if you haven't already, we want you to print out the candidate handbook. Okay, this is going to be your roadmap along with recommendations that we will share during our snapshots as well as during our masterclass. Now, if you're not familiar with our masterclass offerings, go ahead and go to our website, drsellarseducate.com, and that's where you're going to find a self-paced course. And we are approved as an accredited provider, so you are eligible to receive contact hours. And you're also going to see our monthly boot camp. That is an opportunity for you to engage in live sessions with colleagues just like you that are on the nurse educator journey, either towards just achieving a better experience as you move forward on your journey as a nurse educator, or maybe you do have a goal of achieving your C&E. All right, so let's go ahead and go to our blueprint. So for the C&E exam, you're going to find content aligned with our discussion today with competency 6, specifically G, being able to engage in self-reflection and self-care to improve teaching practices. All right, so self-care has a direct correlation with our ability to support a rich learning experience for our students, and ultimately it can create a barrier in our ability to help students achieve success. Okay, and then in Dr. Caputi's book, we want you to take a look specifically on page 99 through page 102. Okay, we're going to be talking about a lot of content that is aligned with those specific pages in Dr. Caputi's review book. All right, so I think that everybody's ready. If you haven't yet printed out that study worksheet, we don't want you to stress about that because you will have a chance to do that later. Okay, print out that study worksheet, but we do want you to take notes. Our goal is that as you're continuing on your journey, that you are mapping out what the next steps are going to be for you. Okay, so if this is the first time you're joining us, welcome. If you are joining us for the second or third time, or maybe you're tuning in every week, we're delighted that you are back. Welcome back, everybody. The 12 biggest mistakes, we mentioned those earlier. So let's talk a little bit about what they look like and reflect on how far we've come already. Okay, so we started on this journey and we want to talk about specifically what those previous mistakes were. Okay, so first we're going to take a look at the ebook. If you don't have a copy of it, it is also listed right here in the description. So we started out by talking a little bit about what our goals should be and how that can create a barrier to our success. We then explored how do we manage the work overload that we experience. Number 3 were strategies specifically to help us engage in those strong classroom management strategies that help create an inclusive learning experience that promotes civility. Number 4, our ability to engage in collaborative relationships. Number 5, a mistake that we make that we want to make sure we correct is underestimating the importance of communication. We want to engage in collaborative communication with our students. We are a partner with our students on the journey to helping them achieve success. Number 6, neglecting our professional development. We want to carve out time, and I know there can be many times in the semester where it's more challenging than others. Number 7, not seeking feedback. That is a core principle as a nurse educator that we want to engage in. And number 8, I know many of us experience this challenge, which is trying to be perfect, right? Striving for perfection can create unrealistic expectations that we create for ourselves, and it can lead to unnecessary stress. Number 9 was focusing solely on content delivery. We want to engage our students in the learning process. When we think about Malcolm Knowles' adult learning theory, his work specifically talks about the importance of self-actualization, being self-directed in our learning. Our ability to engage our learners on the journey with us can help improve their resilience, their engagement in the learning process, and ultimately being more responsible and accountable for their own learning. All right, so now that brings us to number 10. So as you think about what your alignment is with some of the content that we've talked about, we want you to, first of all, write down what your next steps are going to be, okay, on your journey to achieve nurse educator excellence, nurse educator success. And then the second step we want you to follow is to consider when you print out this actual workbook, this ebook, we want you to identify what are some of those strategies that are going to help you individually overcome or avoid these 12 biggest mistakes. Okay, so maybe you don't see yourself in any of these mistakes that we're talking about. That's great, but we want you to have an increased awareness of your knowledge as it relates to each of these mistakes so that you can avoid them. Neglecting self-care can lead to increased stress, burnout, and decreased overall well-being. The solution is to prioritize self-care by setting aside time for that physical activity and engaging in activities that really excite you, that really get you in the mood to be a better nurse educator and ultimately being able to identify what your next steps are going to be on the journey. Engage in the learning process with our learners, right? We know that it's all about engagement. So let's take a look at our thought-provoking question. Dr. Casey, a well-respected nurse educator, has been known for dedication to students and program development. However, in recent months, colleagues have noticed increased irritability, missed deadlines, and signs of exhaustion. Despite frequent encouragement from peers, Dr. Casey insists that self-care is a luxury, not a necessity, and continues to answer emails late into the night. Student evaluations reveal declining engagement, with some students expressing concerns about unclear expectations and delayed feedback on assignments. What is the most effective strategy Dr. Casey should implement to prevent burnout and sustain long-term teaching effectiveness? A, develop a structured time management system that includes protected time for breaks, strategic workload prioritization, and scheduled periods for self-care. B, continue prioritizing work over personal needs, ensuring all professional obligations are met first before considering self-care. And adding vacation days to help with self-care. C is delegate classroom instruction and administrative tasks to colleagues while maintaining involvement in research and committee work. All right, so I want you to pause and reflect on what you know about this question, what the question is really asking you. And if you need additional support, we do have 20 thought-provoking questions with rationale that are also available. You can find that right here in the description as well. All right, so we look forward to coming back and having a conversation about the correct answer and those incorrect answers. I want to think about what is the best answer. Now we're going to go back and take a look at our content that we're going to explore as we dig into some of these concepts that we're talking about to make sure that you have closed your knowledge gaps, looking at the pages that we discussed earlier, and also making sure that you know exactly where to find the content that we are going to be discussing. Okay, so a lot of it is in Dr. Caputi's review book, and then there's also some information in the actual presentation slides that we're taking a look at here. Neglecting self-care, it's a vital concern. It's important for us to understand the impact that it has on our well-being. Taking a look at competency 6 in your handbook for the CNE exam. If you're on the journey for CNE novice or for CNE clinical, it is aligned with continuous quality improvement. Our ability to be the best nurse educator that we can be to support student success is directly linked to balancing. Okay, so being able to balance our workload commitments, yes, but also balancing the self-awareness that is needed to make sure our mental health is cared for, to make sure that our self-development, both professional and personal, is also balanced, and making sure that we are prioritizing to create a balanced lifestyle. Now, I realize sometimes can be more challenging than others. We want to consider that, and also just making sure that we're advocating for ourselves, that we're speaking up for ourselves, and that we are communicating any concerns that we have to the leaders that we have in place. More than 1/3 of the faculty workforce is expected to retire within the next decade. Some specific nursing programs have seen even 2/3 of their faculty, some 40% of their faculty, turning over within a 3-year time span. That's alarming. So, what is it that we want to focus on? First of all, remembering that physical health matters. Engaging in regular exercise specifically promotes well-being and vitality. Emotional support systems. Having a sense of community to support you is going to enhance our resilience and our emotional strength. And then mental clarity. It is going to help us practice. If we're able to practice mindfulness, it is going to help us reduce stress and improve our focus, engaging in that mental clarity and growth that we all need. CNE review on the go is one way that colleagues have reported that it helps to decrease their cognitive overload. We know that there's competing priorities and there's only so much time in a day. Having the CNE review app on the go, colleagues have said that they're able to review information, gather information about concepts that they may be unclear about, as they have just a few minutes sometimes to listen to some of the content that will help them achieve success. And there's also videos. Okay, so that's the great thing. Consider that as a resource to help you maximize the time you have and to help you balance. We want to make sure, as we're considering where our gaps are on the CNE journey, or as we're exploring how to improve our competencies associated with those sub-competency behaviors on the CNE blueprint or listed in the competencies, you want to identify who is it or what next steps needs to be in order to provide the support that you need. Okay, so remember that self-care is about identifying what your individual needs are. And sometimes that is through a colleague, getting support from them. As an example, if you are struggling understanding exam analysis, partnering with a colleague to help you balance that workload, to help you better manage it, is going to be the best strategy instead of trying to figure it all out yourself. Okay. Another good example when it comes to emphasizing self-care benefits is looking at the actual faculty models that you all can integrate within your college. As an example, some colleagues really enjoy co-teaching a course. Is that an option within your institution? Okay, so again, you want to consider what are some steps that I can follow to help advocate for myself and not jeopardize my self-care, nor jeopardize the quality of the nursing program, right? We want to consider both as we balance how we move forward to ensure that we are creating rich learning experiences for our students and that we mitigate our chance of burnout. Boosting our mood, we know that's a great benefit when it comes to being able to balance our day, because let's be honest, stress does affect our mood. Research tells us that. Our ability to have an increased awareness of that is directly aligned with Malcolm Knowles' adult learning theory and our ability to self-actualize and determine what our needs are. Second benefit is increased productivity levels when I'm able to focus because I've managed my stress. Number one, I've advocated for what I needed. And number three, I'm able to delegate appropriately and partner with colleagues to ensure that I'm decreasing that cognitive workload and that I am increasing my productivity and efficiency in the tasks that I am responsible for. It creates, when we're able to advocate and manage our stress and promote self-care, it creates a calmer mindset overall, not just in the academic setting, but our entire day. Sometimes we may feel like there's not enough hours in a day to achieve the goals that we have identified for ourselves. So how can we change that? Going back to it was actually number one, right? Mistake number one is not prioritizing or setting our goals. So making sure that we identify what is that one, if we had to, one must do activity that I have to get done today. Like I can't go beyond today. And then think about how can you get to that one specific objective that you have to achieve. Now, I'm not talking about the task like grading papers, right? That's our normal activity. But if, as an educator, that's just a responsibility that we have. But I want you to think about, and I'm going to stop sharing for 1 second. I want you to think about what type of activities do I have to get done today? What is that one project, right? For me, I'll give you an example. When I'm looking at my research and my publications, I want to make sure that I follow a certain schedule. If that's one a year, that I'm submitting an abstract, or twice a year, whatever that frequency is, I'm going to dedicate specific time through my week to be able to focus on that specific activity. It's unrealistic to think I can sit down and write an entire manuscript right in one sitting. So we want to identify, especially if we're co-authoring a manuscript, we want to think about how am I going to carve out time every single week and estimate, step number one, estimate how much time do I think it's going to take me to write this manuscript. Okay, so that's what you want to do. You want to create a time block and schedule that's realistic for you and allow you to break it down in steps for you to achieve one section of it at a time, if at all possible. All right, so now we'll go back to our presentation and talk more about what your next steps are going to be. All right, so we've talked about all the benefits. Now I want you to take a minute and reflect on this question. How does self-care impact both your teaching effectiveness and your personal well-being? Okay, so I want you to write 2 influences associated with self-care for you that you've noticed in your classroom or in your personal life. All right, so I'll give you an example. For me, I know when I'm not balancing everything well, my personal well-being can be affected by me not getting enough sleep, right? Because I'm concerned, I'm anxious about not accomplishing the task that I set out to do. It can affect my teaching effectiveness because when I'm reviewing my students' questions or when I'm grading assignments, I can not be as attentive as I normally am. I can sometimes be short in my communication with my students. So I have to have that self-awareness, right, that Malcolm Knowles talks about. And so what are you going to do about it, right? I don't want you to just think about how self-care impacts you negatively. I also want you to think about how you can transition to it creating more of a positive influence on your teaching effectiveness and your personal well-being. So I'll give you an example. I started implementing a nighttime routine where I no longer, after 9 o'clock, I'm no longer responding to students, okay? Especially if it's been a long day where I'm interacting with a lot of my students for assignment feedback, or maybe discussions I'm having with them, or maybe I have live office hours. If I've had a long day, I know that fatigue is going to set in. So 9 o'clock, there's no more contact with students. And I engage in the self-care therapy of using lavender. Okay, so lavender is my oil of choice. It's an essential oil and allows me to decrease my anxiety and brings calmness into my body. All right, so that's what I want you to do. Yes, I want you to write down 2 negative influences associated with stress and burnout when we don't take care of ourselves. One associated with your teaching effectiveness and one associated with your personal well-being. And I want you to write down 2 strategies you can use to shift that from that negative category into that positive category. When I end my day no later than 9 o'clock, so I'm not responding to students, and I'm engaging in using an essential oil that helps me calm myself and my system, then I'm more likely to get a good night's sleep, and I'm less likely to be short with my students or to not deliver quality work. All right, so that's what I want you all to do, to think about what are your challenges associated with the lack of self-care. So what's your number as it relates to concepts and your knowledge about the content that we have discussed for continuous quality improvement? Think about some of the theories we talked about. Think about some of those strategies that we discussed related to how we can shift our negative burnout behaviors associated, or the behaviors that attribute to burnout, shifting those to more positive behaviors that lead to resilience and ultimately giving us more peace, more joy in the work that we do. So how are you feeling about competency 6? 1, you feel lost. 5, you feel like you're ready to teach this content that I talked about, okay? And the really important part is you want to make sure you're aligning it with learning theory, right? And application and analysis level, because we know 80% of the content on the C&E exam are at those mid to upper levels, all right, for Bloom's taxonomy. Pages 188 through 190 in Billings and Halstead, 6th edition, if these are muddy points for you, if Bloom's taxonomy, learning domains are muddy points for you. All right, so now we're going to wrap up our time for this snapshot by taking a look at our thought-provoking questions. So I had a chance to think about what the best answer is. Let's take a look and see how close you got to it. So if you chose A, develop a structured time management system that includes protective time for breaks, strategic workload prioritization, and scheduled periods for self-care, you are correct. So give yourselves a round of applause. Now let's talk about the rationale. Implementing structured time management techniques such as time blocking or the Pomodoro technique, that's what it's called, allows for intentional rest periods without compromising responsibilities. This approach improves focus, preserves teaching effectiveness, and reduces long-term burnout. When you're going through these thought-provoking questions, or if you're using Dr. Caputi's review book and you're taking a look at the practice questions, or maybe you're taking a look at the self-assessment exam that is offered by NLN, whatever resource you're using, we want you to look at the rationale for the incorrect answer as well. Okay, so let's do that. B was not correct because this approach reinforces an unsustainable cycle of burnout. While professionalism is critical, neglecting your personal well-being to only vacation days ultimately affects student learning. Specifically, it negatively affects student learning, right? Because we're exhausted if we're waiting on vacation days to take a break. And then C is not the best answer because while delegation can be helpful, shifting responsibilities without addressing personal boundaries can also lead to increased burnout and does not resolve burnout. Okay, it may create actually additional stress if not paired with intentional workload reduction and self-care practices. All right, so we hope that the rationale for these incorrect answers is helpful as well. Hopefully, your rationale was similar to what we kind of talked through. And the good news is we want this to be exactly what it said, right? A thought-provoking question. We want to stimulate thought as you consider what the correct answer is and the rationale for the correct answer and incorrect answer. All right. And now as we wrap up, we want you to remember that we are here to support you on your success on the journey towards C&E. Only 70% of nurse educator colleagues in 2024 achieved success on the C&E exam. Okay. And we know that we have had 98, we continue to have 98 to 100% success on the C&E exam with our nurse educator colleagues that follow our 7-week study plan. Reach out to us if you have further questions, info@drsellarseducate.com, or you can reach us and find out about our programs on our website. We hope that this snapshot has been helpful and we look forward to seeing you the next time. Have a great one, everybody.